Hello, hi, I am Dr. Kelly Wright. I am an emergency medicine physician here in Miami. I work out of HCA Florida Kendall. I'm also fellowship trained in hospital administration. We're working on this Dade County Medical Association podcast, and I have Dr. Barrau here. Hi, how are you?
Yes, hi, I'm Carmel J. I'm the president of the Dade County Medical Association. I'm also the co-founder of the Herbert Wertheim College of Medicine, and I sit as the chair of the advisory council for the dean. So thank you for having me.
Oh, thank you for coming. So I have a few questions for you as we start this new podcast. What is the DCMA?
Well, DCMA is Dade County Medical Association. It's an association of physicians, MDs and DOs that were funded in 1903. So we are about 100 plus years old.
Oh, one of the oldest?
100 plus years young, I might say. And our goal is to educate, to advocate, and to network. Because us physicians, we are so engulfed into our career that we do not have time to get together. We don't have time to share ideas. So this is why the DCMA is there to bring us together and bring and exchange ideas, both medical ideas, political ideas, and also financial ideas for the better good of our clients, of physicians, of patients, and the good of the public in general.
Okay. So why is it so important to join an organized medicine group like the DCMA?
It is important because, again, like I said, we are so into our career that we do not have time to look elsewhere but to our practice, our patients, and so on and so forth. When you join a medical organization, you know that your voice will be heard. To point of view education, we do offer CME products. We do offer to our medical students many opportunity to present their posters and so on and so forth. So it is very important that the old generations is also able to mingle with the new generation. This is the networking aspect of the Dade County Medical Association. There might be many things that I might be able to teach the new generation coming so they don't go through the same hurdles that I have been through. Okay, or there might be some important information that a young generation has about, a lot of techniques have changed, a lot of ways of disseminating information, like the podcast. I didn't have that when I was a medical student.
I know, it's one of the newer things.
Exactly, So this is very important that we keep the conversation open so we can communicate and pass on informations back and forth. And advocacy. Very importantly, because you practice medicine today, but do you know that the way you practice medicine is very dependent on how the laws are written in Tallahassee?
So other people tell us what to do.
Well, essentially, yes. And we, for example, we just about 2 weeks ago, we were in Tallahassee, a delegation, about 12 of us who went to Tallahassee to educate our representatives and our senators and to listen to their ideas about how the practice of medicine should be done in the state of Florida, how certain laws passed for the good of the patients and the good of the medical professions should be written so there is no unintended consequences of many of those applications. And we're here to defend the professions because we are under assault. Many people wants to be us. Okay, we're not even called most of the time physicians anymore. We are called healthcare providers. We're not taking care of patients anymore. We are taking care of healthcare consumers now. Okay, so all those things have to be clearly delineated so our patient know exactly what is it that they're dealing with when they're seeing a so-called provider. Is it a physician or is it some other healthcare delivery person?
And then what else does DCMA offer? Do you guys offer any events or anything that like the members can all join and do?
Absolutely. in addition to the medical education, we have financial educations because and there's going to be a few podcasts about it. Okay, yes, us physicians, we're busy. We make some good income, but what good is it if the income that we make is completely splundered and dilapidated during our reproductive years? So when we reach time of retirement, there's nothing left. So we make sure that we have multiple presentations about how, at the beginning of your career, how to handle financial issues, in the middle of your career, and toward the end, how to handle things so you can have a happy and a worthful retirement. So we offer that to our members at no cost to them.
Okay. And then I guess going back to what you're saying that you're going up to Tallahassee, do you guys have a specific committee, a political action committee?
Yes, we have a political action committee, which is essentially different from the Dade County Medical Association. It's the political action committee is there to raise money for candidates running for elections, to make sure that the candidate that we support are the ones that have the best interest of the medical profession and our patient at mind and heart, because other aspects of the political spectrum do not necessarily have so. And understand, well, politics is a very bizarre animal. What makes a lot of sense to us as physicians could be completely different on the political side. So we want to make sure that when a politician take a decision who he thinks or she thinks may be a good idea, we want to make sure that that it goes through the medical profession so we can explain to them what's good about it, what not so good about it, or what's simply bad about it. Yeah. So we can change their mind and change the way the laws are written.
Okay. So that's more or less what you guys were doing up in Tallahassee.
Yes. And the Political Action Committee raises money to help candidates we feel are in favor of our medical professions and in favor of our patients, so we can send to Tallahassee people that can really make a difference in terms of how the practice of medicine is done in the state of Florida.
Okay. Nice. So I guess another question for you. So what is this YouTube channel project that we've just started, if you don't mind shedding a little bit light on it?
It's like I said, okay, when I was a resident, we did not have that way of communication. I mean, if we were sitting in a room where there was a conference, if you were lucky enough to be there, you would be there and get the informations. But 48 hours later, if I wanted to remember what was said, unless I have a booklet or something like that, I would probably not know. But with that podcast that we create, the informations will be there for anybody and everybody to review. All the physicians coming after us will be able to look at that podcast and say, oh my God, this is how it is. And you have no idea sometimes one little phrase said on a podcast and saved for the posterity can change the career trajectory of an entire generation. So we hope that among everything that we've discussed today, those young physicians or not so young physicians will find something that they say, aha, this is what I've been looking for. This is what I expect. Okay. So they can change a career. They can change the path they've taken for the better good.
Yeah. So how did this project start? So who started it?
Well, we here at the DCMA, we have a board, we have a committee, medical executive committee, and we have the PLA. You know a lot about the PLA. Okay?
Yes, I do.
It's a leadership association, okay, that helps form and shape our future leaders, okay? And I know that you're part of the PLA. I was a PLA participant many years ago, and I can tell you that it really structured my mind. And here I am today, president of the Dade County Medical Association. So keep it up. Yeah. You might get there.
For those listeners who don't know, so the PLA is a Physicians Leadership Academy that's held in combination with Dade County, Broward County, and Palm Beach County. So we all go and we have certain little sessions.
And it's free for our members.
Yes, which is a nice little added bonus. All right. And then one last question. So how should members or how should doctors in our community join Dade County?
Very simple. Okay, they can go online. type in Dade County Medical Association. We have a website. We have in the website, you click a button. It brings some information that you fill out. You click a button, and there you are. You're a member. As long as you either live in Dade County or work in Dade County, you are eligible to become a member.
Oh, okay. So for anybody who doesn't know, the website is miamimed.com. Miamimed.com.
Yes.
All right. Well, thank you, Dr. Barrau, for coming on.
Thank you, Kelly.
And hopefully this podcast turns out well.
Oh, it will. I will. Certainly. Thank you.
Thank you.